I'm here with you on behalf of the company that you represent, which is Listerine, the brand that we have been always so close to. And it's nice to have you here.
Oh, thank you.
I hope you're having a nice time together with us in the Congress.
Oh, wonderful. It's my first time at a SEPA conference, so I'm thoroughly enjoying it.
I think it's been quite a nice one.
Very good lectures this morning.
Yeah, and it's quite crowded, and we are kind of recovering some feelings that we thought we had lost. So it's nice to have you here.
Thank you.
Yeah. So first of all, I would like to begin by asking you, what could you say about Listerine within your company? What does it represent?
So Listerine is a very important brand for us. Within our company, our focus is all about how can we empower the patient and the healthcare professional to ensure that patients and consumers can actually enjoy and live everyday health better. And what I mean by that is all about self-care. I mean, I'm a healthcare professional, so I'm a periodontist myself. We can see a certain amount of patients, and we can see them on a number of occasions. But ultimately, my patients go home, they're in front of their mirror, and they're in front of their own bathroom, and they have to perform their own healthcare routine. The role we very much believe in our company is how can we empower patients to take ownership of their health so that they understand the benefits that it can provide them and live that on an everyday basis, but also improve their quality of life.
But it's not a new product that you have. I mean,
absolutely
it's
not.
It's been with us forever, but now you are like reborn, no? Or you have new energy.
So I think there are a number of reasons. We're very lucky to have Listerine within our company portfolio. As you know, Listerine is actually the most researched of all the mouthwashes globally. It's the #1 mouthwash brand. And the research has been published in peer-reviewed journals, randomized controlled clinical trials, more than 100, and they've been published for more than a century. There's more than 135 years of research. And in fact, as we've done a recent meta-analysis, there are more than 30 RCTs, which are over 6 months in duration. So we're sitting on a wealth of data. One of the reasons for the renewed interest is actually partly because of what you in SEPA are doing as part of the European Federation of Periodontology. There is renewed interest now since the new classification on the importance of periodontal health.
Yeah.
I think as dentists in the past, wrongly we used to think of gingivitis as being a bit normal, a little bit of bleeding we'd have put up with. You know, the data now shows us that actually it's all about prevention. And that's where Listerine fits in as part of that 3-step routine together with mechanical therapy to ensure that patients can maintain their supragingival biofilm on a daily basis at home efficiently, easily, but also effectively.
So apart from that preventive view, how can we improve patients' quality of life? I mean, we as partners, how can we promote together the oral health through preventive approaches? How can that have an impact in the daily basis and the daily life of our patients?
Well, I think that's one of the reasons I decided to join Listerine, because one of the things you realize when you're a clinician is that you can only treat a certain number of patients in your life. But ultimately, we need to get that message out not only to the patients that we see, but also, unfortunately, to those people who don't always visit a dentist. And there was a recent paper published in The Economist that showed that despite the increased efforts that we've all been making as clinicians on giving oral health messages and the investment that governments have been making, unfortunately, the prevalence of periodontal disease for the last 30 years has been relatively stable. So I think we have to all take a step back and be very honest that what we're doing so far has been great. We have made great strides. However, the patients out there aren't always listening to what we're saying. You know, they've got increasingly busy lives, and we have to understand how we can adapt our messages, still being evidence-based, but in a pragmatic way. And I think, you know, there's data out there that despite the fact that we tell people to brush our teeth twice a day, we tell them to do it twice a day for 2 minutes.
And they don't.
And of course, we all do that, but as you said, they don't.
No, they don't.
You know, the average time for brushing is only 45 seconds. Interdental cleaning, we all tell our patients to either use interdental brushes as an adjunct, or if the spaces are too small, to use dental floss. Again, I was stunned by the evidence that says less than a third of patients actually interdental clean ever, not on a daily basis, but ever. So therefore, we have to accept that a certain amount of plaque is being left, and we need to think about ways in which, from a compliance perspective, they are more likely to supplement. And I think that is the simple public health message. You know, we got that message out about fluoride many years ago, and we've seen the change in the prevalence of caries. Actually, I think it's time for us to step up as periodontists to think it's not about just treating the severe cases, but how can we prevent disease in the first place?
Yeah, and that's the difficult thing. Because, for example, at least here in Spain, I see that the moment in which you can really approach the patient is when they are suffering and they have pain or they are worried. But the preventive strategy is quite difficult to implement because the patients feel, well, they are not patients. I mean, people feel that they are not going to need it. So
absolutely. And I think that's where an organization like SEPA has huge importance, because ultimately we do know that patients and consumers listen to healthcare professionals. Their messages are very important. And if we're fair, we haven't been consistent in our messaging.
No,
We've been talking about mechanical. So I don't think there's any consumer out there that doesn't know they shouldn't be brushing twice a day. And predominantly, they think about caries, they think about dental decay, and they react when they get pain. Part of the advantage, but also the disadvantage of periodontal disease is that it's the silent killer. We know that. By the time patients come to see us and they're in pain, it's too late. They don't feel pain at that early stage, and I think we have to figure out how we can almost make periodontal health sexy. You know, we need to figure out, you know, whether it's tapping into the insight that they want fresh breath, whether it's tapping into the insight that they like the feeling. Actually, to us, that doesn't feel important, but that's what our consumers and patients want. Ultimately, what we want is for them to maintain their health. And I think we need to understand how, as a dental community, we can give a consistent message and ensure that's reiterated by our other healthcare professional colleagues, so by the pharmacists, by the general practitioners, so they get a consistent message everywhere they go, because we know that left untreated, severe periodontal disease has potential systemic ramifications, which can lead to premature death. You know, we know from cardiovascular disease, diabetes, and also adverse effects with pregnancy. So it's our duty to try and stop, to try and educate them on the benefits of what your mouth can feel like if you do clean it properly.
Yeah, that's the thing. I think we have to change the message and try to show what we can win and not what we can lose.
Absolutely, not negative. It has to be a positive message.
Yeah. Yeah, but you know this sentence that you only care about health when you lose it, when you miss it.
Yes.
So that's a little bit what we need to prevent that situation from coming. We need to give the strength to the message of how good it is to feel fine and
Absolutely.
to be healthy.
And I think it goes more than that. I think we have a duty to actually work with government authorities and other organizations. I know the WHO, EFP are already doing this, because we have a globally aging society. at the end of the day, they're going to have heavily restored dentitions, which are going to be harder to maintain as they get older. And loss of teeth, as we know from periodontal disease, can result in major effects, impacts on masticatory function, disability, as well as diet, and severe impacts on quality of life. So we don't want those people to suffer later on. As well as that, we're unfortunately in Western Europe in a big cost of living crisis. The cost of dental treatment is expensive, and actually prevention will pay by actually maintaining things on a daily basis. We should use this opportunity that comes post-COVID, when people are much more aware of their health and much more aware of the benefits in order to tap into that.
I think it's not being heard. Something happened with her microphone.
Can you hear me now?
Now.
Yeah.
Yep.
Yeah. So leverage
No, it goes.
leverage the benefit.
No, whenever you move, I think it's when you move. You have to talk to them. Look at the picture.
Look at you.
No, I don't know.
Hello? We need to leverage. Yeah. Okay. So we need to leverage the learnings that have happened post-COVID, where people are taking more accountability and ownership for their health, to translate that into dental health, because ultimately the mouth is the opening to the whole body, and consumers and patients are starting to understand that more. It's our duty as dental healthcare professionals to take them through that education, and it's our duty as companies to help support healthcare professionals as they go along that journey by providing them patient materials and educational assets that are engaging, simple, and will help their patients follow those simple 3 guidelines of using a 3-step routine twice a day.
Yeah, but we have to find a way to give a clear message to the patients, because I feel that they trust more what they find on the web or what somebody tells them, more than most of the times what we tell them to do or tell them to use, or the information that we might eventually give them. And I don't know if that's to blame on us as professionals, or I don't know.
So I think we're living in a very different world now. Whether we like it or not, Dr. Google exists.
Yeah.
However, all the research does show that advice from a healthcare professional, and this data includes dental healthcare professionals, is the primary reasons that a patient or a consumer will follow a specific regime or buy a specific product. So we have a lot more power than we realize, and it's very important that patients are educated on the fact that, yes, you need to read around, however, you need to make an informed decision, and that's where consistency comes in. At the moment, as I said, we have been very inconsistent in our message. We've been telling patients just to do a 2-step routine. We know that they weren't going and doing that properly. Now that we understand it's all about prevention and maintenance of health, it's important that we consistently talk about a 3-step routine, about the importance of not missing that cleaning occasion, be that when they're tired and they've gone out, and the importance of instilling that in their family from a young age. I think the opportunity will be with the young, because
yes,
actually,
for sure.
To instill behaviors in children in school is going to be much easier than changing someone my age who's had habits of a lifetime. But we have to start, because we owe that to our patients.
For instance, have you checked what ChatGPT says about ChatGPT, the IA?
Yes.
Have you checked what it says about dental routines or dental hygiene routines?
So I have, yes.
Have you? And what does it say?
So ChatGPT.
Yeah,
ChatGPT talks just about brushing. It doesn't actually even mention the time for brushing, because the time that is recommended by different dental associations globally differs. So some associations talk about 3 minutes, some talk about 2 minutes, some talk about 1 minute. So, and I was shocked that some associations have actually even mentioned, not in Europe, have mentioned once a day. So it's not surprising that if a consumer or a patient then goes on to Google or ChatGPT, they're going to get a confused message. And I think that's the opportunity for SEPA to drive consensus so that there is a single-minded message around you've got to brush interdentally clean and use a mouth rinse on a daily basis.
And could you tell me which are the main commitments of Listerine towards research and education among oral health professionals?
So we, as I explained right at the beginning, we fundamentally believe in empowering the patient and the consumer to take ownership of their health. And empowerment begins with empowerment of the healthcare professional. So our role is always to be science at the heart and science-focused. You know, we are committed, we've got over 135 years, as I said, of research on Listerine. We're published in peer-reviewed journals, and we've got more than 30 6-month or longer clinical studies. We are committed to continue on that science-based entrenchment. As well as that, we work very closely with key opinion leaders, academics, but also patient groups, because it's important to ensure that everything we do is going to be relevant and brought to help educate both the healthcare professional right from school all the way through to their postgraduate and continuing education, but also in the patient messages. And the advantage of an industry and partnership with an association and with KOLs is that actually we also are able to tap into the consumer. So what we can then ensure is the message that goes direct to consumer via television advertising and all other media is consistent. So whatever place the consumer or the patient looks, they're seeing the same thing. I think the problem at the moment is the lack of consistency.
But what you're saying is very, very true, that we have to take into consideration the opinion of patients to know what they really need or what they feel like, or what, I mean, take them into account, in a word, because most of the times that kind of paternalism that oral health providers have, that we decide what they need, that we intervene directly in their treatment plans, but not give them the chance to speak up, to say what they want. And it's not that they make their opinion be ahead of ours, but because they don't have most of the times they don't have as much knowledge as we do. But their opinion is the most important thing. So that must be taken into consideration.
That's so important. I've been a periodontist for 30 years, and I think one of my greatest learnings when I moved to help provide work in industry was that I came in, I think, very arrogant. I've been treating patients, I know best. My patients all do what I said. No. And the first thing that Johnson&Johnson, Kenvue made me do was go and sit with patients, sit with consumers who weren't even seeing dentists and hygienists, to understand their insights. Why are they brushing? When are they brushing? Why are they using interdental aids? What are they experiencing? What are they using as a mouthwash? How are they using it? Are they using it per the instructions that are advised? And it was eye-opening. I suddenly felt all the work I'd done for 30 years, I probably had never listened to my patients in that way. And we always begin every activity with a patient talking. Ultimately, our job is to serve the patient and ensure that the products and services that we provide are going to benefit them. And unless we listen to them and their needs, we won't be able to serve and deliver according to what their preferences are.
I always give a class to my students about prognosis, periodontal prognosis, and I always show a case. I just show them the pictures, the X-rays, and it's a very severe case, periodontitis case, of a 50-something years old woman, non-smoker, but most of the teeth have a fatal prognosis. And I asked them, what would you do? And most of my students say, I would extract all of them. I would start from zero, put implants. And then I say, that patient is my mother. And she didn't want to extract
Lose her
a
teeth.
single teeth. So, and that was like, I don't know, 15 years ago, and she has all her teeth. So that's why I try to explain to them that strategy and treatment planning is not the same. There's no an ideal treatment planning, and there's not only one approach to what a patient needs, but the opinion of the patient must be really taken into account.
It's so true, because the patient insight is at the core of everything that has to be done. I always remember talking to a consultant oncologist, and he said, we keep telling our patients to stop smoking. And he said, but actually one of my patients came in when they had stopped smoking, and I asked them why. And they said, I didn't want to lose my teeth. My dentist told me I might end up with dentures. And actually, I was telling them that they could, die, and they weren't worried. And they were worried that actually they didn't want to have dentures. So that trigger is going to be different for every single patient.
Yes.
And it's very important we listen to our patients, our consumers, in order to understand what we can do to help motivate them along that journey. Because actually, behavior change is very hard. And we're asking for a major behavior change for them to understand the importance of prevention versus just treatment.
And the last question that I had is, what's your opinion from your company about the role of SEPA, a scientific entity? And what do you feel, or what do you think about our partnership? What a company like yours feel when they bond with us? What are you looking for?
So we're very proud to be key strategic partners with SEPA. The relationship with you is very important to us. And I mean, we can see from the conference here today the excitement, the enthusiasm from all the delegates, the fact that you're keeping people up to date. But that's ultimately what we're here to partner with you on. You are, and you know this, so I don't have to tell you, but your members are leaders in the field of periodontology. I feel honored to be in the presence of you and of all of your colleagues last night. I almost feel like getting autographs from Professor Songs and David, and I'm like, you are my heroes, and the heroes of periodontists around the world. And I think one of the reasons that I have so much respect for SEPA is that it's very easy in dentistry to get carried away with what I call the sexy dentistry. The bit that I used to love, all the mucogingival surgery and doing the implants. But ultimately, as you said, your mother is the person at the end of that. I had a very similar situation. My mum didn't want to have implants. And that
was it.
That was it. I'm like, you haven't got the manual dexterity to use an interdental brush in between your furcation. She goes, don't worry, I will learn. But I will not lose my tooth. That's part of me. And that's why the SEPA leadership, driving with the S3 guidelines in the EFP, the concept of periodontal health, and what we need to do in order to maintain that on a daily basis, I think is pivotal for periodontitis and for periodontal treatment as we move forward. And I think we'll come back in years to come, and we owe SEPA a great deal of thanks.
So thank you so much for you being here with us, and for SEPA it's also such a big pleasure to have you beside us. One of my first meetings when I joined the SEPA board, that was more than 10 years ago, was in your headquarters. So it's so nice for me to be here with you. And I hope that a lot of new and great themes come up from our partnership, and I hope to see you next year with us again.
Thank you very much.
Thank you so much.